My resilience has leveled up after the COVID-19 pandemic.
I think they're the real heroes in this frontline pandemic.
Fighting through everything, all of the fears and anxiety with the pandemic.
We say thank you for staying committed to saving lives.
To be a little bit more patient and to be grateful with all the people that's working.
Prevention is quite key, like it's vital, is more like a primary focus.
Before we begin, please subscribe, like, share, and activate the little bell. Hello everyone, welcome to Love Without Fear, a tribute to healthcare workers, an online program of Global People Daily News, GPDN, an independent international news media. I'm today's hostess, Ashley. Speaking of year 2021, the first thing that comes to mind is COVID-19, right? The coronavirus pandemic has affected our lives, our economy, and nearly every corner of the globe. In the United States, as of mid-February, more than 932,000 COVID-19 deaths has been reported in total, the highest known number of any country. Globally, there have been more than 423 million cases and more than 5.8 million deaths. Recently, the highly transmittable variant Omicron quickly becomes the dominant strain of the coronavirus. It took a month and a half to match the death rates that the Delta wave took nearly 3 months to reach. The Omicron variant, which has spread disease to tens of millions in the United States since late December. In this time of severe epidemic, how can we protect ourselves and others? At the beginning of today's online program, we're lucky to have Brian Kang, who works as a phlebotomist and a lab assistant at a local hospital in California, USA, to share with us. When facing an influx of patients, putting a strain on the hospitals and the medical personnel, what magic did he use to face the epidemic when he was working as a frontline medical worker? Let's welcome our first speaker, Brian Kang.
Hi everyone, my name is Brian Kang. I am a phlebotomist and lab assistant at a local hospital. I live in California, United States. It's been a long time since I have stayed at home and went to work daily since the pandemic started. I did not have Thanksgiving, Christmas, and New Year parties and gatherings in 2020 due to COVID-19 pandemic. People were sick and unable to go to work when the pandemic started. I was worried, scared, and terrified about going to work when the pandemic started because I had never seen this deadly virus in my life. Fortunately, I am a Taijimen Dizi and have been practicing Qigong for 10 years, so I can overcome my fear from watching Taijimen brothers and sisters sharing videos who are working at the hospital and how they deal with obstacles and difficulties. Our master was very concerned about all the Dizi health and safety when the pandemic started. Master teach us how to practice the breathing pattern to enhance lung function and immune system. He released 3 don'ts and 5 do to preventive measure for health and well-being. 3 don'ts are as follows. Don't lose your temper to maintain the balance of body and mind. Don't worry when you are well prepared. You need not worry. Don't be anxious when you understand the situation. You need not be anxious. 5 do are as follows. Wash your hands frequently to stop the transmissions of pathogens. Drink more warm water to remove toxins from your fluids, tissue, and organs. Do more exercise to boost your metabolism and get more sunlight to increase resistance against disease. Be happy. This will help keep your immune system in good condition. Be more careful. Pay attention to disease transmission and preventive measures. It was very useful for everyone because it was based on science. I was practicing Qigong every day and meditation to enhance lung function and boost my immune system. I had to practice Qigong every day because I had to go to the COVID room to draw blood from 3 a.m. to 12 p.m. in the hospital. I had an experience working all day long in COVID ward, and later on the hospital became full of COVID-19 patients after the 2020 Thanksgiving all the way to the 2021 March. I felt exhausted after the walk, but I followed the precaution protocols and changed all the clothes when I arrived home and took a shower and nap. I practiced Qigong before going to bed and going to walk. It made me feel well and peaceful in my mind. I cannot go to Tai Chi Mat in person, but I can attend the online classes to practice Qigong every week. I feel happy and healthy after the online Qigong class because I can release my stress and refill my energy. My resilience has leveled up after the COVID-19 pandemic. I have a lot of tools to improve my physical and mental health via Qigong practice. Thank you to my master and Tai Chi Mat Qigong Academy for coping with me all the years. Thank you, everybody.
In addition to external protection, it's also important to take care of your body and mind. Just as Brian Kung mentioned, through practicing Qigong and meditation, indeed enhance his lung function and boost immune system. Sherry Fowler, who is also a frontline healthcare worker, she's also here to share her story with us. Let's welcome her right away.
Hello, my name is Sherry Fowler. I'm a nurse in the school district in Palo Alto, and I'm a nurse clinician that sees the diabetic students in the elementary school age group. And I've continued working during the pandemic because I really do enjoy being with the children. They're such amazing kids. They wear their masks, they follow all the rules, and they carry on as if there's no pandemic going on. Their joy is boundless. But I also love the staff. The school secretaries and the teachers are absolutely amazing. I think they're the real heroes in this frontline pandemic. They come every day, they stay long hours after school ends, and I think they're superstars. And I think just for the kids of the future, I think the children will be a lot stronger having lived through this pandemic and put up with all the rules they've had to cope with every single day. And I'm super proud of the kids as well. So thank you very much.
After listening to Sherry Fowler's sharing, I believe our audience who are also joining this online event have the same feeling as I did, full of excited and joy. It's very important to maintain a good mood. When we view the world from a different perspective, the world becomes vast and wide. Try shifting our perspective in everything we do, and all will be light and easy. The pressure on healthcare workers is far beyond our imagination. Not only the source of stress from the spread of coronavirus, but also the different look from others. People tend to keep a distance from them deliberately because of the high risk of infection, which caused them alienated from the public. Moreover, even some food delivery riders were reluctant to deliver food to hospitals for fear of being directly infected. But even so, many healthcare workers remained at their posts, fighting for the health of patients and supporting them in their struggle with disease. Our next speaker, Rosemary Dowell, a health services coordinator for the Palo Alto Unified School District, California, USA, who is also doing her best to contribute to the society in her own field. Let's welcome her.
Hi, my name is Rose Dowell. I'm the Health Services Coordinator for the Palo Alto Unified School District, and I have been here for a little bit over 5 years now, and I've stayed working here through the pandemic, mostly because I really care about making sure that health isn't a barrier to students attending school, and I think the pandemic, that everything about that is public health. So doing what I can to help the students return to school, be in school as much as possible, has been a big focus for me. It's why I went into school nursing in the first place, is to be in prevention, health prevention education, versus kind of in the hospital where they're already sick. I've tried really hard to keep them out of the hospital as much as possible. And so I've stayed working, looking at all of these kids coming to school every day, doing their best, fighting through everything, all of the fears and anxiety with the pandemic, but they come and put on a big smile and try to learn at their best every day. So I think, looking to the future, my hope for society is that we can kind of just learn to love and accept each other even if we don't agree with each other, and really, take each other in with open arms and assume best intentions of people, and, be okay with our differences and love them either way. Thanks.
I totally agree with what Rosemary said. Indeed, when we disagree with others' opinions, we don't have to accept them, but we still respect their different ideas. Because respect, listening, and understanding are the essential elements in a democratic society. Thank you, Rosemary Dowell, for your appeal and insights. The world will become a different and better place when we're open-minded and with love. And this is a thought-provoking point that deserves to be deeply thought about and practiced. As the epidemic ravaging the world, apart from healthcare workers protecting our health, people still have to go on with their daily life. When facing the education and care of children, what are the impacts of the epidemic? Let's welcome Ubani Vivian's sharing.
Hi, my name is Ubani Vivian. I'm a passionate educator and childcare professional from Nigeria. As the outbreak of COVID-19 ravages the world, with no end seems in sight, people across the world are on the edge. With repeated cases of people attacking healthcare workers who are on the front line with tremendous pressure, mentally and physically exhausted. As a childcare provider, many years ago, I was infected with chickenpox and I was forced to isolate. That period alone was one of the challenging and difficult times, and still committed, ensuring that I keep myself safe and the children in my care safe. So imagine a healthcare worker who is committed to saving life, protecting his or her own life, while ensuring that the lives of others are safe. The healthcare workers are not appreciated enough. Joining other supporters across the globe in solidarity, we say thank you for staying committed to saving lives. Working as a childcare provider at this time is one of the critical and most challenging moments while carrying out your job. However, we appreciate the healthcare workers and caregivers for their resilience, for their commitment, for their hard work, for their courage, for their bravery in service to humanity. Let's continue to encourage them. They are our heroes. They don't need to wear a cape. We say thank you for all the work that you do. We will support you. We send you all the love and light from across the world. The lives of our care workers matters.
During the 2 years of epidemic, and because of the united efforts of professionals from all walks of life to reduce the transmission of the virus, now let's listen to medical doctor Dr. Carlos Quiroz sharing his life and experiences as a result of the pandemic.
Hello, hi, I'm Dr. Carlos Quiroz. I'm a medical doctor from Honduras. I used to work for the medical emergency in Hospital del Sur in Choluteca, and right now I'm currently doing a PhD degree in Taiwan. I want to take this opportunity to be grateful with all the staff that is working in the front line of prevention and detection of COVID-19. So my experience as a doctor, it's really hard to keep us away from the hospital. We usually spend hours and hours going to the hospital working, attending people every day. We do it with honor and with respect for everybody. So imagine on a normal day scenario, we have a lot of patients in the emergency department. Everybody's required attention, and some of them is more critical than others. And the numbers are already high. Now, if you see during this pandemic, the numbers have doubled, even tripled. So the amount of patients that we receive every day must be extremely high for the number of doctors and nurses that are working, and overall the whole medical staff feel overwhelmed with the amount of people that they receive. So actually, I really would like to ask everybody to, understand the pressure the doctors and the medical staff is, and also to doctors be patient with the people, and they understand that their anxiety is high and they don't know what's going to happen. So just to ask everybody to be a little bit more patient and to be grateful with all the people that's working really hard to keep everything under control. Thank you, everybody.
Do not underestimate ourselves. Even though we may feel that we're just ordinary people who have nothing special to contribute to this epidemic, but that would be a mistake. Sometimes a warm greeting or encouragement from us can be the motivation for those healthcare workers to keep on their work. In the face of a serious epidemic, the most important thing is for people to join hands and face the difficulties. During today's online program, let's send the good thoughts and blessings to appreciate those hardworking healthcare workers' efforts. All of you who are now watching our program are welcome to leave your best wishes to the healthcare workers in the message board, which can be a cute little sticker or a warm word of encouragement. I'm sure this love will encourage those who are working hard for us. As the saying goes, prevention is better than cure. Our next speaker, she is the programmer and the communication officer of the Voice of the Vulnerable. How can she defend herself while also protecting others in the face of the escalating Omicron epidemic? What about the members in the organization? Let us listen to what she has to say.
Oh, hello. My name is Mrs. Smith Okocha. I'm the Program and Communication Officer of Voice of the Vulnerable. Thank you, Global People Daily News, for the wonderful opportunity. Sharing my thoughts around the ravaging COVID-19, the pandemic, and healthcare workers. I'm a public health expert. Healthcare workers have really had their blow with the COVID-19. Those in front lines that have been fighting since the outbreak, so many have lost their lives, so many were affected, some were treated, and some also died. What our organization does, we try to reach out to the people alternatively. Ordinarily, if there's an outreach, you want to have face-to-face contact with the people. No, this time around, we use that, but not as often as it should be. We use an alternative, our social media handle, by creating awareness. First is knowledge, as in, what do people know about this? We let the people know. Look at what the voice. We became a voice to people. Those that don't know about it, there is more like sanitization. This is what's going on now. This is why these are the preventive measures. This is why the vaccine is very important, so that you can stay alive and safe. As a healthcare worker, we didn't leave ourselves. We needed to protect ourselves. Our organization, our volunteers, our workers also know that you need to be protected to reach out. Prevention is quite key, like it's vital. Is more like a primary focus. When people know, they will know what to do to prevent being affected. And once there are lesser people that are affected with this vaccine, it will not spread to stop. So we've been able to reach out to people, have community outreach as minor as we can.
After listening to the insights shared by these 6 speakers today, I think that apart from the exchange or provision of supplies or relief, what is more important is the interaction between the hearts and the mind. If you have been touched after watching our channel, Please remember these feelings and share this energy to your life, even influence the people around. During this time, we appreciate educators to use new forms of education to teach students. We're also grateful to all the people for reducing non-essential travel and wearing masks in the high temperatures, so that the human race can gradually overcome the severe epidemic. I think the world will become better and better. Let's share the seeds of kindness from the bottom of our hearts. Make the world become better. In the age of pandemics, there is more talk of disease and deaths than the hope and goodness. At the coming end of today's online event, let's listen to the song, Alla Vida, that celebrates life, pays tribute to divine creation. And let's talk about love and joy in the midst of the storm that is overwhelming the world in crisis.
Salen sobrando, lo que importa es el sentir que estamos vivos y podemos entonar esta canción, tu canción, mi canción.
Thank you for taking time to watch. We look forward to hearing what you have to share. You can leave an encouraging message, your own medical experiences, or share stories about how you spend those days working from home. I wish you all the best and hope to see you again soon. Goodbye!